Today, we are going to take a look at a BodyViz brain builder about the digestive tract and IBS. In this brain builder, we will discuss the anatomy of the stomach and how Irritable Bowel Syndrome, or IBS, affects the digestive tract. IBS is a common disorder that can cause great discomfort due to irritation of the stomach, small intestine, and/or the large intestine. Check out our other BodyViz brain builders to learn more about the intestines. Today, we'll focus on the anatomy of the stomach. The stomach is a hollow, muscular organ generally located in the superior left quadrant of the abdominal cavity. The external anatomy of the stomach consists of the superior, concave, lesser curvature and the inferior, convex, greater curvature, the cardia, which is where the esophagus joins the stomach, the fundus, the body, and the pylorus, which joins the duodenum of the small intestine. Internally, the stomach has a 4-layer wall. The innermost layer, the mucosa, is composed of an epithelium sitting on a connective tissue lamina propria and a thin layer of smooth muscle. The gastric folds of the mucosa, called rugae, allow the stomach to expand to hold food. The submucosa is made of irregularly arranged connective tissue. The muscularis externa consists of 3 layers of smooth muscle. Finally, the serosa, also known as the adventitia, is composed of mesothelium and connective tissue. The stomach receives blood from the abdominal aorta and is controlled involuntarily by the sympathetic and parasympathetic branches of the autonomic nervous system. Irritable bowel syndrome affects both the stomach and the intestines. Syndrome means a group of signs and symptoms that occur together and characterize a particular medical condition. A sign is a medical abnormality observed by a physician, while a symptom is experienced and explained by the patient. The most common symptom of IBS is abdominal discomfort in combination with altered bowel movements. IBS afflicts approximately 15% of the U.S. population, and 4 types are recognized by the medical community. IBS-D causes diarrhea and abdominal discomfort. IBS-C causes constipation and abdominal discomfort. IBS-M exhibits alternating diarrhea and constipation with abdominal discomfort, and IBS-U exhibits varying symptoms. Individuals with IBS usually begin experiencing symptoms before the age of 40. Besides abdominal discomfort accompanied by altered bowel habits, patients often describe a feeling of incomplete evacuation of the digestive tract following a bowel movement, a significant amount of mucus within the stool, or urgent bowel movements. Some patients also exhibit symptoms outside of the digestive tract, such as chronic pelvic pain, migraines, anxiety, depression, difficulty sleeping, and/or fibromyalgia. IBS symptoms often fluctuate in severity with certain foods, beverages, or stress triggering flares. The overall cause of IBS is unclear, but current medical theories include abnormal muscle contractions of the stomach and/or intestines, abnormal nervous activity within the stomach or intestines, abnormal changes in the microbiome of the digestive system, abnormal bodily responses to a stressful lifestyle, abnormal chronic responses to a bacterial or viral infection, and additionally, family history can indicate risk, as genetics and environment may play a role. There are no clinical tests to diagnose IBS. However, it is important to talk to your doctor if you're experiencing unusual digestive symptoms. IBS is typically diagnosed through a combination of medical history, exam, and observed signs and symptoms. Treatment of IBS aims to relieve symptoms. Common recommended treatments include daily exercise, relaxation techniques such as yoga or meditation, changes in diet, fiber supplements, and medications. Because symptoms of IBS vary so greatly from patient to patient, some can tolerate their symptoms with little or no change to their daily life, while others find little relief regardless of their lifestyle changes and treatment. Let's take a look at a patient example. You receive your patient's file and take a look. Age, 34. Sex, female. Chief complaints, bloating and loose stool for the past month. You invite the patient into your office for an examination. She reports having an upset stomach more often recently and now has uncomfortable bloating and diarrhea almost every day for the past month. You ask her if she has noticed anything else unusual, and she tells you that she's lost weight unexpectedly and has had more frequent headaches. When you ask her whether she's noticed any foods making her symptoms worse, she says that she feels worse after eating bread, pasta, or pizza. According to her family history form, her mother has IBS. The patient's symptoms are consistent with IBS, but may also indicate celiac disease. You decide to order an endoscopy. For this procedure, a tiny camera on the end of a long, flexible tube allows you to look into the small intestine and collect a tissue sample for testing. The tests come back negative, ruling out celiac disease. Having reviewed the patient's symptoms and family history, and after ruling out celiac disease, you diagnose her with IBS-D. You let her know that many individuals with IBS-D feel relief after removing gluten from their diet, and you recommend starting there. You also have her try a non-prescription antidiarrheal medicine. While you can't cure her IBS, you tell her that if she is willing to adjust her diet, you are optimistic that she will feel better and get back to more of her normal routine. This has been a classic example of Irritable Bowel Syndrome. Thank you for watching this Brain Builder video. Please like and subscribe to our BodyViz channel, or, if you are new at BodyViz, check out our other anatomy resources and schedule a demo at bodyviz.com.